say that it's painful, and it's kind of, I don't know if it's almost more in my groin or in my hip. I don't know. I don't think it's impingement. At some point in your career, you either have or you either will feel something in your hip. And it's hard to discern what's just sort of normal hip soreness and what could be hip impingement. And that's exactly what we're going to address in this video today, because it's all well and good for me to give you strategies on how to improve your hip mobility and your hip stability. But really, the best way we can improve your performance is to keep you from under the surgeon's scalpel, keep you on the ice feeling happy and healthy and moving the way you need to move. And the way we do that is by taking a really proactive approach to hip pain and hip impingement. In part 1 of this series, I went over the basic anatomy of the hip and what impingement is. So if you missed that, now would be a good time to go back and pick it up. I'll put the link somewhere, definitely in the description for you, so you can make sure that you kind of have a picture of exactly what's going on and how hip impingement is a chronic overuse injury. So even if your hips feel perfectly fine right now, you could still be doing micro trauma to your joint that eventually will lead to hip impingement. Before we dive into it, I want to ask you a few questions about your hips, if that's okay. Okay. The first question, do you feel kind of an ongoing discomfort in your hip? And maybe it's in the front of your hip, the outside of your hip, closer to your groin. Do you feel anything like that? Okay, do you ever feel an intermittent discomfort? So it kind of comes and goes, but again, it might be in the front of your hip, the outside of your hip, closer towards your groin. Do you ever get some of that? Okay, let me ask you another question. Do you ever feel a pinch in the front of your hip or towards the groin? How about it just kind of feels stuck? You know, sometimes when you're doing a squat, it's just like, I don't have pain, I don't have a pinch, it just won't go. Okay, do you ever get catching or locking in your joint? And have you lost range of motion recently? Okay, well, let's sit down and we'll have a little chat about what that means and whether it's anything to worry about at all. Okay, so how do we know if any of those things are actually impingement? And if it is impingement, does that mean automatically that you're going to need surgery? So I'm going to give you the number 1 action you should take if you said yes or sort of kind of yes to any of those questions above. Before I do that, would you do me a favor and hit the like button? It just really helps me out, so I appreciate it. Now let's get on to what you should do if you answered yes to any of those. And really, if it's a like, well, once I get warmed up, it's not that bad, that's actually a yes. So the action that you should take is you need to go see a good sport physiotherapist. It doesn't need to be somebody who's an expert in training goalies. There aren't that many goalie-specific physiotherapists out there, but you know, someone who's worked with hockey players, someone who's worked with soccer players, someone who's worked with dancers or figure skaters, all of those types of athletes have hip issues, so they will have for sure seen hip impingement. They also might not look at you like, well, you shouldn't do that, you know, when you kind of explain what you need to be able to do on the ice. So when you go see the physical therapist, they're going to do an assessment, and they're going to do some specific assessments on your hip to see if, yeah, maybe there's a chance there's some sort of hip impingement going on. They're really straightforward assessment tests. I actually covered a couple of them in the comprehensive guide to hip impingement in goalies. I put that out maybe last fall, and it's a PDF that tells you absolutely everything you need to know about hip impingement in goalies. So if you're a goalie or a goalie mom or dad, or a goalie coach, that is a must read for you. If you haven't read it yet, I'll put a link in the description where you can go and download a copy. It's totally free. But they'll do some of those tests. They might also look at your ankle mobility, how your back works, because sometimes too we'll have, or more often than not, we might have pain in a certain area of our body because another area of our body isn't doing its job, or it has some sort of dysfunction, and that's what's putting the force or overloading another joint. So they should look at that, but they'll be able to do these tests to sort of say, yeah, maybe this is an impingement. Don't worry, don't panic. It's not the worst news you could get, because there are different causes of impingement. Yes, this could be, a bony impingement like I talked about in video 1 of this series, but it could also be that your joint capsule. So your joint capsule is kind of like a connective tissue sock that engulfs all of our articular joints, and it helps keep synovial fluid in. It also is full of joint position receptors, so it sends our brain information about the position of our joints and how our muscles should be working to maintain stability. But sometimes that tissue, it's very fibrous and it can get restrictive, and so if it's that's sort of getting that's restricting the motion and causing the impingement, then the physical therapist can use their manual therapy skills to do some capsular release, and it's pretty hard to do on yourself. So don't think like, oh no, I stretch all the time. Stretching and capsular release are two different things. So they can use some of their specific techniques to try to give you a little more space in that joint, and then you're going to be feeling better, like right away, you're going to be feeling better, moving better. So that's one option. Now, even if it isn't a capsular restriction that's causing your discomfort or intermittent discomfort, and let's say it is the development of a bony impingement, the physical therapist can still do a great job of helping you identify restrictions in your range of motion, can take you through a sequence of physical therapy that actually for a lot of goalies really improves their functioning. So targeting specific ranges of motion. We can't physiotherapy the bony impingement away, but we can help you use your hip in a way that doesn't put you in those impingement positions. Maybe we improve your torso stability a little bit so that you're just more stable and controlled over that hip and not sort of slopping around getting into that impingement position quite as readily. So it can really help. And in some cases, goalies who think that they're going to need surgery, do a good course of physical therapy and get a lot of symptom relief out of it, and they're able to maybe not eliminate the need for surgery, but push the need for surgery, 1 or 2 seasons down the road, or at least to a time when it's more convenient for them to do that. So regardless of the cause of your hip dysfunction or discomfort, your first step should be a good sport physical therapist. And I've said it time and time again, but they really have the hands-on skills and the experience of assessing different joints and assessing lots of hips and knowing what sort of is normal and what isn't normal. And then, they apply a treatment, and if the treatment is making it feel better, then they know they're on the right path. If they're doing the treatment that typically makes, just sort of a minor hip impingement better and it's not getting better, then they also have the experience to say, you know what? I think there might be something else going on here. Maybe it's time to get an MRI or get someone else to look at this hip and see, hey, we might be at the stage where we need surgery. And I mean, if you need surgery, no one wants to have surgery, but if that's what your hip needs to get it so you can move again and play without pain and have a butterfly flare again, then, that's what you need to do. And it's a pretty straightforward surgery. The recovery is a little bit funny because everybody is so very, very different coming out of that surgery, but there's it doesn't mean it's the end of your career, not by any sense of imagination. What it means is, hey, I've got a second chance to really come out and show what I can do on a hip that actually moves. Also keep in mind that old saying, an ounce of prevention is worth a pound of cure, and doing proper goalie-specific off-ice training, the kind that helps build all these factors we've talked about. Maintain your hip mobility, give you the hip stability and the core stability that you need. Feel like I have a bug on me right now, but I don't. Give you the core stability and the hip mobility and hip stability that you need to reduce the wear and tear on that joint. That's not only will that all improve your performance, but it can also help preserve your hips so that maybe you never have to, experience one of these issues. If you really feel like, it isn't really, I changed my mind, it isn't really anything, I don't need to go see the sport physical therapist. Another thing you could try is go to your app store, search Butterfly Challenge. It's a free 14-day goalie mobility program I put together for you. Wade into that. Stay away from anything that gives you hip discomfort or leads you into that block position or gives you a pinch or whatever, anything that doesn't feel right, leave it out. But gently work on the rest of it and see, hey, does that improve your hip range of motion at all? Does it improve how your hips feel both on the ice and off the ice? If it does, then it suggests that, hey, we've got room for improvement here. If it, now I feel like the bug's in my shirt. I feel like I have a bug in my shirt is what I feel like. I hope I don't, but the show must go on. So it tells you you've got some room for improvement and that maybe it's just, you just need to be doing the right kind of mobility training. If you work on that consistently for the 2 weeks and you don't get any improvement at all, again, that suggests like, hey, this isn't really a soft tissue issue. This is probably a bony impingement or a capsular restriction. So that reaffirms, yes, I had better be calling my local sport physical therapist maintenant. So those are a couple ideas for you. If you've already done the butterfly challenge and you've had great results with it, then your next step up is the pro style mobility program I designed. It's called Strategic Mobility. So it's just at strategicmobilityforgoalies.com. For those of you who have done the butterfly challenge, drop a comment below just telling all the other goalies about the great results you get, because it blows your mind. Like, I get emails from you guys that, like, I've only been doing it for 3 days and already my hips were, you know, moving like they've never moved before on the ice, that kind of thing. So drop a little comment in, because when other goalies see, you know, your comments, that helps them to take action so that they can save their hips and play with freer hips and make more saves and get more shutouts and be the hero, basically. So that was a little bit of a talking head video, but you really have to understand that hip pain, hip dysfunction isn't just normal, isn't just a normal part of the job, and then in a lot of cases we can really, really improve that, and working with a good sport physical therapist is sort of your #1 way to do that. And stay tuned for the next video where I'm going to go back to showing you exercises that build sort of the strength and the stability that let you use your butterfly more effectively on the ice, what I call dynamic butterfly mastery. That's the next video with some brand new exercises, so make sure you catch that. Probably a good idea to subscribe so that you're not going to miss that video when it comes out. And I will see you then.